Yeah. Very good evening to all of you. At the outset, I would like to thank the whole team of OSWB, Pushpita ma'am, Dr. Subhashish Nag, and the whole team for organizing such a wonderful webinar and a webinar of the OSWB with AIOS. It's a wonderful concept, actually. And inviting me to speak in this webinar, I'm really delighted and very thankful. The question that has been posted to me, that has been sent to me, is what is the right time to restart refractive surgery? Well, this time will vary with locality, with location, with individuals. However, I'll be talking about this whole issue in general. And there are various queries actually coming in the mind of people that, and why this question arose, because there are people who are thinking that why at all we are concerned, can we go ahead and do it? What are the risks? What are the precautions to be taken? And when is the right time to start refractive surgery? The question is why at all we are concerned. The reason why we are concerned is that if we do manipulations in the area or layer of the eye where virus can be present, then the virus can spread. So we have to think about what are the possible locations of virus. And now we have come to know that virus attaches to ACE2 receptors. So we have to think about the locations of ACE2 receptors. And many studies have shown, and these are the major studies that have shown, that there is expression of ACE2 and transmembrane protease serine 2 genes in corneal epithelium. So cornea and conjunctiva are likely to be infected with SARS-CoV-2, and that's how the tear film also gets the virus. Now, ACE inhibitor is also seen in aqueous humor and trabecular meshwork and ciliary body, retina, etc. But it has been noted that the co-expression of ACE2 receptor and TMPRSS2 protein is seen in cornea and conjunctiva, and it is because of the co-expression where is the area where there is co-expression where the virus attaches itself more. So the manipulation done in the cornea and conjunctiva can cause shedding of virus, and that is why we are concerned, because the refractive procedure is mostly corneal and also lens-based, but mostly corneal. And these corneal procedures are excimer laser procedures, which can be done with microkeratome or with femtosecond laser. It can be, LASIK, it can be surface ablation. Then we can have only femtolaser procedure like SMILE. And then, of course, we have lens-based, that is phakic implants. Now, first, I will talk about phakic implants because phakic implants are one that are not an obvious aerosol generating procedure. So we are not that much concerned about it. The OT etiquettes will remain as cataract surgery, and these all have been very nicely highlighted by Dr. Lalit Verma and Dr. Namrata Sharma. So I won't go into it. You use triple layered mask, cap, sterile gloves, and gown, etc. And if you prefer topical anesthesia, then the risk of causing any spread or any aerosol generation by giving block or manipulating at that time is also gone. So if you're preferring topical anesthesia, it's reasonably safe and we can go ahead even now. So we can start it now, and there are people who have already started it. So one can keep doing without much concern. Coming to the laser corneal procedures, we use microkeratome to create flap, and that can generate aerosols. All excimer laser ablations can generate aerosols. There are some who are of the opinion that transepithelial PRK may generate more aerosol. Now, SMILE probably because the laser is fired within the cornea and it's not exposed at the time of firing of laser, and then you just remove the lenticule, so probably will have least aerosol. So, however, having said that, these are all based on logic, and there's no comparative study as far as the aerosol generation is concerned. But in medical science, a lot of things work on the basis of logic. So that is why we have to be a little cautious. So the question is, when is the right time to start these laser refractive procedure? Now, we know we have been discussing over the last almost more than an hour and a half, that this pandemic is going to stay. And that's what Dr. Maipal also emphasized, that it's going to stay. And we have to understand how best we can adjust to it. We have to live with it, and we have to adjust, and we have to adjust our ways to handle the patients in this change scenario. And with passing time, there may be increasing number of COVID patients. So is it the right time to start the refractive procedure now? I feel yes, we can start the laser refractive procedure now, because studies have reported that the prevalence of virus in tears is not that high. And there have been, different reports in terms of, creation of aerosol with NCT, creation of aerosol, or marked inconsistency in PCR results from conjunctival swabs. So all these are because the prevalence of virus in tears is not very high, unless the patient is there is very severe viremia. And if there is very severe viremia, in that case, obviously the patient will be symptomatic and will be having frank COVID. So obviously he will be out of your list. So we don't have to worry about those patients. So we will be handling only those patients who might be having little bit of viremia. And in those cases, the load in the tears will be low. And it has been shown in proven in literature that excimer laser ablation of cornea in HIV positive or HSV positive patient is mostly safe. And since it's a daycare procedure, and if performed with proper protocols, it can be considered safe. Of course, we have to take precautions, because we don't know, there may be some asymptomatic carriers. So we have to maintain physical distancing, and which was it was very impressive presentation by Dr. Arup Chakrabarti, who showed how it should be done in the OPD, and how to minimize contact with currency. And if somebody gives currency, how to handle that with UV rays. COVID test is optional, of course, because of availability and non-availability of the test. And we keep learning every day. Pushpita ma'am was telling that, we learn new thing every day. And that is a fact, that we learn a new thing every day in this COVID era. And as far as refraction is concerned, one should avoid touching forehead of the patient to measure the working distance, so as to avoid contact with the patient. The trial frame, pinhole occluder, and lens should be wiped with alcohol swab, and the NCT should be avoided, and one should do applanation tonometry, and the prism should be cleaned with 70% isopropyl alcohol, and that, of course, will be discussed by Dr. Manavdeep. The breath shield has been already emphasized. People have made different kinds of barriers between the patient and the doctor. So basically, the idea is to have a separation between the patient and the doctor, so that there is no aerosol, coming to the doctor from the patient. The patient is at all having some viremia and is asymptomatic. And as has been mentioned earlier, that once one patient is examined, all these areas should be cleaned thoroughly, so as not to infect the other patient who comes next. As far as topography is concerned, which is essential for laser refractive procedures, for any refractive procedure, topography is a non-aerosol generating procedure. So it can be done. The only thing is, patient should not be waiting for very long, and patient should be wearing mask while doing, say, pentacam, etc. And once the patient leaves, whatever area he touches, although he should be asked not to touch anywhere, but if whatever forehead, etc., he touches, the skin touches the instrument, that area, all areas should be cleaned with isopropyl alcohol. Ultrasonic pachymetry can be done, and one should try to maximize the distance. Whosoever is doing ultrasonic pachymetry, he should try to maximize distance as far as possible, so that there is no direct touch with the aerosol. One can have various barriers also through which you can take your hand inside and do it. The probe tip can be cleaned with 70% isopropyl alcohol between cases. And here, most of the times in refractive procedure, we used to have the same clothes of the patient, and patient used to wear just a gown and come inside the OT. Here we advocate that the patient should wear OT clothes, he should change. Betadine should be instilled in the eye before the procedure. And of course, it should be removed thoroughly after 2 minutes. Then patient should be in a mask. And of course, surgeon should maintain all the OT etiquettes. As far as the excimer laser procedure is concerned, the additional thing that I would like to emphasize is to use goggles because it is an aerosol generating procedure. So one should use goggles, and doing a procedure, examiner is a procedure with goggles is not such a big issue. It's not like a prolonged procedure, or you don't have to keep watching through the oculars. You can see the monitor and go ahead and do the procedure. And of course, it should be done properly in aseptic conditions, and the surfaces should all be dried. There shouldn't be any pooling of secretions. And at the end of the procedure, the disposable should be sanitized, and it should be disposed as per the biomedical waste policy. So in conclusion, I think it is time to start the refractive procedures, and there are people who have already started. Uh, there is no evidence also of spread following refractive procedure, because worldwide people have been doing refractive procedure now, and there is no report of anybody getting infected by refractive procedure. So that is something which is also an evidence that we can go ahead. However, there is possibility of transmission. So due precautions should be taken in order to avoid the risk of getting infected. Thank you very much. And as I said, this is something which can, of course, change with time, what we are thinking, what we are discussing now. And this is all very dynamic. So thank you very much, OSWB, once again for giving this opportunity.